I am Amit Mohan, President and CEO of Barlow Respiratory Hospital. We are excited to share with you our plans for the future. But before we do that, let's just start with the story of this hospital. In 1902, this hospital was founded by the determination of one man, Dr. Jarvis Barlow, who, after being stricken by tuberculosis, decided to establish a place to care for these patients. And actually, during 1918 pandemic, the influenza patients were taken care of in that building by Dr. Barlow. The building right behind me was built in 1927. And in that building, since the advent of ventilators, the ventilator-dependent patients have been coming to Barlow to get liberated from the ventilator and to be taught to breathe on their own. Our physicians, nurses, respiratory therapists, an entire clinical team have been working for years to perfect the art and the science of weaning patients from ventilators. For as long as ventilators have been around, we have been taking care of those patients. Patients who come to Barlow are very sick. Some have been given little hope of recovery at the hospitals that saved their life, and they come here to learn to breathe on their own. Here we see patients speak their first word after months and literally take their first step after months, but we also see patients take their last breath here. Our hallways are narrow and the rooms are small. These rooms, built in 1927, do not allow us to provide the comfort and dignity in those last moments, which are equally important as the good care that have come to define us over decades and years. Please join us as we continue our transformation to build a new hospital that will enable us to provide comfort and dignity to our patients, along with the high quality care that has come to define us for many generations. We have already begun the work. We built the new fluoroscopy suite. We are in the midst of building new pharmacy and rehabilitation gym. And once that is completed, we'll begin work on building new patients' room and a brand new ICU, where majority of single rooms will enable our clinical team members to provide good care in a safe environment with comfort and dignity. The single rooms will enable us control and prevent the spread of infections. The spacious environment will allow the patients and family dignity and privacy. When a loved one is ill, a hospital can become like a second home, where the patients and family can be cared for with dignity and in privacy. Sometime during 2023, we'll be caring for the patients in brand new rooms in a healing environment. And once the new hospital is built, we'll transform our entire campus into the best post-acute destination in Southern California. Thank you to all our team members who have continued to provide excellent care during this pandemic. Thank you for supporting our campaign to rebuild Barlow. And a special thank you to all our physicians and hospital partners across Southern California.
Thank you for supporting Barlow. We truly appreciate all you do to help us save lives.